Hi students, this is Dr. Badrinath and today is a very small topic, very small. Within a 10 minutes we can complete one entire concept of anti-leprotic agents. Okay, and here only 3 drugs are important. Remain not the entire concept, only 3 drugs. I will tell you what are the 3 drugs, how to keep in your mind that and all I will explain you. See, anti-leprotic agents these are the nothing but medicines. These are nothing but the drugs which are used to treatment of the leprosy. This is he is a leprosy patient. So we know that there is a degeneration of all the fingers, hand fingers and leg fingers. That is a toys, all the toys, and the facial eyes. Okay, and certain parts of the eye will be undergo the degeneration. So slowly it disappears, all the fingers and all. So that is a main characteristic of the leprosy. Okay, and if you see this thing, this is one of the important bit which was appeared in your GPAT and all competitive examination throughout the India, in all the states, like pharmacist examination, RRB, okay, drugs inspector examination. Which of the following oil is used to treat the leprosy? Okay, coconut oil, castor oil, linseed oil, chul mogra oil. Chul mogra oil is the correct answer. Okay, it is having a weak anti-leprotic property. Okay, it is having a weak anti-leprotic property. Okay, and this was given in the Tripathi textbook itself. Okay, right, and this is one of the important bit that you have to keep in your mind. And this is my mobile app. You can be downloaded from the Google Play Store. All my video presentations are available in the form of a PDF. So before examination, you can have a quick view. Here you can go to the store option. After downloading, you go to the see the pointer store option. There in the store option, you can find all my videos in the form of PDF like M.Pharmacy course. All courses are there. Pharma.D. And this is about my mobile YouTube channel that you know very well. If you go to the playlist option, see the pointer playlist option. I have arranged all my explanation videos subject wise, okay, later topic wise. If you click on each subject, you will get a topic wise. So this is your syllabus. Here you can find the anti-leprotic agents. So here you can see the definition anti-leprotic agents. These are the medicines or drugs used to treat the leprosy infectious disease. Leprosy patients, you can see here the real picture of the leprosy. And this is the infection is caused by the Mycobacterium leprae, like a TB. This is somewhat similar to the TB. TB is caused by the Mycobacterium tuberculosis. Here also same family, almost the same family only. Name is little difference. Mycobacterium leprae. The disease name is changed. Mycobacterium tuberculosis, Mycobacterium leprae. It is a slowly growing organism. This is small, very slow, just like a TB only. Small years together it takes. For one division, it takes nearly more than 24 hours to divide one cell into 2 cells. Okay. It is a incurable disease in olden days, but nowadays it is curable because very effective drugs are available. But keep in your mind, these degenerations you cannot be cured. You need a plastic surgery. Okay, you have to do a plastic surgery to the patient, then only it will be. Yeah, very important classification. If you see the classification, very small classification, sulfones. First one is the sulfone. Sulfone means is nothing but a sulfonamides. You know that sulfonamides, cotrimoxazole. You can see all my old videos. Okay, sulfonamides family only. Example is a Dapsone. Wonderful drug, DDS. Wonder here you can see the Dapsone tablet, sulfonamides. Keep in your mind. And a phenazine derivative, clofazimine, mine. You can call it as close, very close. Mine, mine. It is mine. This pen is mine, like that. Clofazimine. Okay, close, very close. Mine, like that you can remember. And you can see here, I have already told you anti-tubercular drugs. Anti-tubercular. These are the drugs used to treat the tuberculosis. These I have told you that is Mycobacterium tuberculosis. This is Mycobacterium leprae. So the same drugs, tuberculosis drugs also can be used. In the examination, they will ask you which are the following drugs used for the both treatment of antimicrobial treatment of both diseases, tuberculosis and leprosy. Then you can say it is a rifampin, ethionamide, and other antibiotics like aminoglycosidal antibiotics like Oflaxacin, Minocycline, Clarithromycin, etc. and all there. But here keep in your mind, Dapsone, Clofazimine are very, very important. Dapsone, Clofazimine. Okay. And here I have already told you this doesn't come under classification, but this is we are using for the in India medicines for the century. It is having a weak anti-leprotic property. Sulmogra oil. Yeah. Only we will see only 2 drugs, not the entire drugs. Dapsone, Clofazimine. Dapsone, DDS. It is a sulfonamide. Okay. It is a diamino. See here, one amino group is there. Here also one amino group is there. So it is a diamino. Diphenyl. So phenyl group is there. Here also one phenyl group. Diphenyl. Sulfone. See here, sulfone. Sulfur is there. Sulfone. That's why it is called a yes, diamino, diphenyl sulfone. It is the simplest drug, oldest drug, cheapest drug, and it is the most active, most commonly used to treat of its class. Okay, all other sulfones have become obsolete. Okay, Dapsone, and here you can see the mechanism of action is just same as that of the sulfonamides. It blocks this enzyme dihydroterate synthase. So what happened? Para-amino benzoic acid, PABA, will not be converted into dihydropyridase. See here, red mark, blockage of this step. If you not block this step with the Dapsone, what happened? PABA will be converted and the entire cycle will be takes place. And finally, DNA, RNA, DNA, protein, all these are essential for the organism survival. All these DNA, RNA. Now, Dapsone, what it is doing? It is blocking here itself. It is blocking this step. Okay, so automatically what happened? This doesn't form protein. So bacteria will not be survive. Structure also important. And this is completely absorbed orally. It is widely distributed throughout the body. Penetration into cerebrospinal fluid is poor, very poor. Concentrated on the skin. That's why this is a skin disease. Leprosy is a skin disease. Dapsone will be concentrated in the skin. That point is important. Concentrated in the skin of leprosy patient. Excreted mostly in the urine. Dose is 100 mg or less per day. It is a mild, adverse effects are mild hemolytic anemia, gastric intolerance like nausea, anorexia, okay, anorexia. Sulfone syndrome, that is also one of the important things. This sulfone syndrome will be developed due to the Dapsone. Very, very important point. Sulfone syndrome. It is due to the, so this is a reaction. It will be developed within a 4 to 6 weeks after starting of the Dapsone treatment. When you started giving a treatment to the patient, within a 4 to 6 weeks, there will be development of a fever, malaria, okay, lymph nodes, enlargement, etc. will happen. Okay, jaundice, even jaundice also. And clofazimine, it is basically a coloring dye. This is also very, very important. Find the dye which is also used for the treatment of leprosy. Clofazimine. Here you can see the structure. It is having anti-leprotic property, anti-inflammatory property also. Dose is also same, almost same, 50 to 100 mg per day. There it is a dose. Dapsone is 100, here 50 to 100. Frequently used in combination with the rifampin and the Dapsone for the treatment of multi-drug therapy for the treatment of leprosy. Okay, this is mechanism of action of clofazimine. It enters into the bacterial membrane. Okay, and interfere with the respiratory chain, redox system, oxygen, and we know that redox system, oxidation and reduction, both collectively called as a redox. Okay, that we know very well. So it interferes with the respiratory. Oxygen is very essential for the bacterial survival. So it interferes with that redox system, H2O2, hydrogen peroxide, that you know very well, superoxide. So it interferes with the ATP production. ATP stands for the energy. So without ATP, bacteria will not be survived. And the interaction with the phospholipids, lysophospholipids, interfere with the potassium transport. Without potassium transport, there is no production of the ATP. It leads to bacterial death. 2 types of mechanism. And this is the last slide. You can see paucibacillary. It is a small stage. And multibacillary leprosy. It is a 6 or more. See, name itself indicate multibacillary. 6 or more skin lesions will be there. Here 1 to 5 skin lesions means small spots, you can say. Okay, Multibacillary treatment, multi-drug therapy. Whenever you want to use the multi-drug therapy, that is more than single drug for leprosy. Rifampin, you had to use 600 mg once a month. Supervisor. Dapsone 100 mg daily. Multibacillary. If it is a paucibacillary, this is a multi-drug therapy. The table same as it is. You have to write in the examination. 6 months, 12 months it takes. See here, paucibacillary initial stage. Only 6 months is enough. Treatment. Multibacillary, since it is a later stages, it needs a 12 drug and you need to give this. Okay. Here in this multibacillary, we are giving a 3 drug. Rifampin, Dapsone, Clofazimine. Okay. And here only we are giving 2 drugs. Rifampin and Dapsone. Right. So I will end my session here. Right.